If you've been diagnosed with a herniated disc, what is a herniated disc, what does it mean, and how to treat it? So a herniated disc is actually very common. By the time you hit your 20s, you're about 30 to 40% likely to have a herniated disc. However, that does not mean that you have pain. Most of the time people have a herniated disc without symptoms. What a herniated disc is if you picture a balloon filled with sand and you squeeze on one side of the balloon, you move the sand to the other side of the balloon, it distends the balloon, but it stays in the balloon. This is exactly what happens to your disc. You have material in the disc, it bulges out in the disc, but it typically stays in the disc. The reason that it's a problem is it can get in the way of the joint and push on a nerve. So now it limits movement, and if you do push on that nerve, you cause pain wherever that nerve goes. If it runs down your leg like your sciatic nerve, you get pain down into your leg and even into your foot. It even innervates some of your organs. The cool thing is you can actually treat it without surgery by just doing the opposite of what caused the injury in the first place. If you squeeze too much on this one side and you cause the sand to move back in the balloon and distend it, all you have to do is slowly and gradually squeeze down on the back where the sand is and move the sand back to the center. In doing so, you'll take pressure off the joint, you'll restore normal motion, and you'll take pressure off the nerve, allowing that nerve signal to get back to where it was going, and you'll be completely healed. This is so often the case, it's so easy to treat. I'm Dr. Caleb Slater, I'm an orthopedic specialist, and I see this all the time. You do not need surgery, you do not need injections or medications which just mask your symptoms and do nothing to treat the underlying cause, which is actually a structural issue. If you get the right treatment to the right area, you'll improve almost immediately that visit. This is what you should be seeing by your physical therapist, by your physician, and if you're not, you're getting the wrong treatment and or to the wrong area.